Well, here we are, back to the seemingly endless PSA screening controversy once again. Of course, for me, it was never a controversy. I've always stood by this test value because at the end of the day, when used appropriately, it can save patients' lives. And thankfully, for once, I'm not alone in this stance. As you might recall, the U.S. Preventive Services Task Force came out against routine PSA screening for healthy men back in 2012. But in the years since, a whole lot of smart doctors, and I'm proud to count myself among them, have pushed back in the PSA test's defense. Published research shows that PSA testing does, in fact, reduce prostate cancer deaths. So while it may not be appropriate for everyone, men who are at high risk should absolutely be getting screened more often. And even otherwise healthy men should, at the very least, have a baseline PSA test done by the time they're in their 50s. In fact, that's exactly the recommendation one team of experts made in a recent paper published in the Journal of Clinical Oncology. And it makes a whole lot of sense if you ask me, especially when you consider the results from the European randomized study of screening for prostate cancer, which came out back in 2014. This was the largest trial of its kind in the world, and it showed that PSA testing cuts prostate cancer deaths in half. U.S. data also shows a dramatic and sustained decrease in prostate cancer mortality since the first introduction of the PSA test. So, once and for all, the PSA test is valuable, and I advise PSA testing to all of my male patients over the age of 50. End of story. Until next time, I'm Dr. Fred.